Hey everyone. Hi everyone. How are you doing today? So excited to be here on another episode of Dr. Sumner's Summit to Wellness. It's a little bit of a different topic today than we're used to, but I'm super excited to share something that's really close to me, that's come close to my heart, a novel way of delivering healthcare services that I think is very worthwhile for you to hear about. So I do hope that you can join me tonight. I have some exciting news to share with you, along with a number of interesting tidbits and facts that you may not have been aware of before. So please join me. Really, really excited to be here tonight, guys. And if you could also tag your friends, tag those that you think are looking for a different way of possibly getting the best care that you can possibly get from your doctor. So I'm really excited. Join me tonight on Dr. Sumner's Summit to Wellness. So for those of you who aren't aware who I am Dr. Felicia Sumner. I'm your board certified family medicine physician. I am dedicated to getting you and your communities to become well. And to me, well is being whole, energized, and loving life. So I'm excited to have you join me. Let me know if you're here. Please comment and let me know. Hi, Viva Life Health Hub. Thanks so much for joining. Let me know where you're chiming in from, where you're tuning in from. I am, for those of you who aren't aware, in the Philadelphia area. So let me know where you're coming in. I'd love to hear where our viewers are following from. So again, really excited to have you here. So tonight we're going to talk about something really neat, something that maybe you've heard of before, maybe not. I have not heard of this concept until just a couple of years ago, and I've become increasingly researched in it, and I'll tell you a little bit more about why soon. So really excited again to have you all here. And let me know if you're here, wave hi, hit type in hashtag replay. Let me know where you're tuning in from. Doc McDiva, thanks for joining. She's coming in from Greensboro. Hi, Simone, thanks for joining. She's in the Philadelphia area. I'm in the Philadelphia area as well. So really excited to have you all here. Hi, Sharon, thanks for tuning in. So we are going to talk about something called DPC, also known as direct primary care. Direct primary care. If someone can type that in the comments section for me. Have any of you heard of this thing called direct primary care? I took a poll about it a little bit earlier on, and it seems that not too many people are super familiar with that term. So I want to share that with you. Hi, Lynn, thanks for joining. So direct primary care, the best way I can sum it up is that it is like the Netflix of healthcare. So basically, it is when you have a membership model where you are paying a direct membership, just like you would for Netflix or for other things, LA Fitness, things like that, that you pay membership for, to have ongoing direct access to your doctor with extended appointments to discuss all of your concerns, not just one or two concerns. If you have more than that, you also get availability for same or next day appointments when you need them most, and drastically discounted value-added services. What do you think about that, guys? Does that sound interesting to you? Does that sound not so interesting? I'd love to hear what your thoughts are on this idea of direct primary care, and I definitely will get into the nitty-gritty of that a bit more as we continue to talk. Thanks for putting that in. Thanks so much for joining, Abby. Good to see you. And Tammy Tate is here. She says she's in Delaware County. Cool. I am actually in the Delaware County as well. Dr. Kashidi Long said she saw an article about direct primary care about 2 years ago. Definitely seems like the way to go for PCPs tired of the 20 to 30 patients a day lifestyle. Interesting thought. I will tell you what my thoughts are on it very soon. So basically, I'm really super duper interested in this direct primary care model. And why did I get interested? Basically, as a family medicine doctor, for those of you who know me personally or have been patients of mine, et cetera, I I love my patients. I love being really involved in their ongoings, their comings and goings, as much as they will want me to be. I'm not like super newsy or anything, but I like the time that I have with my patients. I like to be able to spend more than 10 or 15 minutes. A lot of times I would find myself as a family medicine physician spending 30 or 40 minutes with a patient and then unfortunately fall like 5 patients behind in some cases, because that was the time that I think that they needed. But unfortunately, with the current model of traditional care, that is pretty difficult for most physicians, especially family medicine physicians, to pull off, to spend that much time with their patients. And aside from that, sometimes in all reality, I felt like I was letting patients down when they would call and need to be seen or felt like they needed to be seen today or the next day. And that just sometimes isn't feasible when you have 25, 30 patients on your schedule. It's sometimes difficult, and you have to send your patient to the urgent care or the emergency room or to see your partner instead, because there's just not enough room in the current traditional model to be able to see everybody when you want to see them or when they want to be seen. RN Den said he's watching from Florida. Good to have you. Let me know where you're chiming in from. Glad to have you guys here. So what other reasons did I get interested in this model? I want to deliver a more comprehensive care, basically, without this huge rush of time. I want to have a say in the quality of care that I provide my patients. I want to be able to find a solution where my patients could get time, real time, to discuss their concerns, where they could receive appropriate and timely education about their conditions or their health status, but not pay thousands of dollars that most can't afford to get a more detailed and personalized solution to their care. Because there is something out there that maybe some of you are familiar with called concierge medicine. Have you heard of that model of care before, called concierge medicine? Hi, Dr. Nicole. Thanks for joining. She's coming in from Maryland. Hi, Dr. Kim. Thanks for joining. Doc McDiva says preventative care instead of just sick visits. Wellness, not just disease management. Amen to that. So there's a model called concierge medicine, which honestly is kind of reserved for the super rich and wealthy, the super famous. Those people pay like, I've got a friend, for example, he gets paid $5,000 a month to provide super comprehensive, personalized care. He sees those patients whenever they need to be seen. He's available by his cell phone. They can text, email, call him. He will even sometimes show up to their house, show up and meet them in the hotel to take care of them, whatever they need. But who in the world can pay $5,000 a month for personal care from their doctor? Maybe some of you are balling like that, but I'm not. And most of the people that I've spoken with can't fit that into their budget. So I wanted to find a way to be able to provide as close to that as I could, but in an affordable manner. I wanted to stop worrying about also the check boxes and the standards that had no true bearing on how healthy my patients are. I don't know if you guys know this, but the average family medicine doctor spends 50% of their time on paperwork. 50% of their time on charting, on filling out prior auths, on handling this and that with the insurance companies. And that might explain why you can't get an appointment with your doctor, or there's never any time for your doctor to talk to you, because we have to check this box and we have to meet this silly standard, etc., etc., etc. And so I wanted to find a way to stop having basically the middleman tell me what is helpful for my patient and ends up actually detracting from the time I could spend providing my patient with the very, very best care. Cynthia said she's tuning in from Maryland. So glad to have you here. Thanks for joining us. So I wanted to get rid of this 50% of time being wasted on paperwork and administration, and to be able to focus much more of my time on taking care of my patients, researching their conditions, researching the best treatment for them, being able to spend a lot more personal time with every patient that I see. And I saw the financial strain that the healthcare expenditures were putting on some people, even those with insurance. People who have insurance, they were still paying out the wazoo for co-pays all the time when they needed to be seen routinely, for medications that they weren't covered by their insurance, or still had a crazy copay because they have to meet a deductible before their insurance even really helps them at all. So I wanted to find a better way. So I'm a solutions-oriented person. When someone comes to me with a problem, I definitely empathize, but whether they like it or not, I often try to find a solution. So I started asking around, even up until my most recent poll that some of you might have seen or taken. What are some of the problems you currently have with your traditional doctor's office? And I'm going to ask you guys again right now. If you go to see your doctor regularly, or once in a blue moon even, do you have any current issues with with the office? Hopefully not with your doctor specifically, but with the workflow or anything? Or are you like super happy? Because I've taken a poll recently. Some people are super happy, and that's amazing. But I'm going to be frank, that's a minority of people, at least from who I've spoken with. And for those that are super happy, feel free to share the names of the folks you're seeing, because a lot of people want to be happy going to their doctor's office. But for those of you that are a little annoyed, a little bit frustrated, a little bit tied up with what's going on at your doctor's, let me know, what are the things, what are some of the problems that you currently have with your traditional doctor's office? I'm making this kind of like a community forum, guys, so please chime in. I'd be happy to hear from you. Hi, Devin, thanks for joining. The Dignity Effect says they hate waiting. She's on time, but she never gets with her doc at the appointment time. Okay, so a big frustration for her is that she's stuck probably sitting in the lobby a lot longer than the time she's actually spending with her doctor. And that really stinks. That's no fun. I understand I'm a very timely person in most situations. And so I can understand the frustration that you take to rush to your doctor's office, to go on a long commute, to take time off of work sometimes, et cetera, only to find that you're waiting in the lobby for 10 minutes, 15 minutes, 30 minutes. I've had experiences where I personally have even had to wait at my doctor's office for over an hour. So I get it, and I can see how that can be very frustrating. Simone says she gets frustrated with the co-pays. Will give you a straight cardiac arrest. Oh my goodness. So yeah, that's serious. That's serious stuff. I mean, even if you have insurance, the co-pays can build up tremendously, especially if you are seeing your doctor on a pretty regular basis. Joe says that sorry, his doctor's so quick to push meds on him. I'm sorry to hear that, Joe, that he feels like it could sometimes be, again, that your doctor has a limited amount of time with you. They are literally unable to spend the time to actually sit down, really get to the root cause, get to the nitty gritty, be able to educate you with the time that they don't have on nutrition, on lifestyle changes, on natural methods that they may even be aware of, but unfortunately, again, their time is so limited. Okay, so I appreciate you guys chiming in about the things that are frustrating you most right now. Things that I've heard through talking with friends, colleagues, other patients in these polls that I've been taking is that a lot of people, that's been said, they are not getting enough time with their doctor, and they're spending too much time in the waiting room versus actually spent with your doctor, because your time is precious. My time is precious, and I know your time is precious too. A lot of people said that they kind of feel like a number and not always like a person because their doctor is seeing so many people. Do me a favor, guess how many patients a doctor, a regular family medicine, bread and butter, traditional family medicine doctor has on their patient panel. Like, how many patients do you think they're supposed to keep track of? How How many patients do you think are like registered with them that they can call at any moment or have to review labs on at any moment? How many patients do you think the average family medicine doctor has on their patient panel? I'd love to hear what your guesses are. The Dignity Effect says, I also get irritated when I pay at the office and then get a bill for a bunch of stuff and not be prepared for what insurance would and wouldn't cover. That is also true too. The unexpected bills, what we sometimes call sticker shock, right? That, you know, you had to pay the copay, you think you're one and done, and then unfortunately, you end up with another bill not too long from then that ends up being something you totally did not expect. And that happens, unfortunately, a lot, even, again, with insurance. So you can get sticker shock. That's another big thing when you pay attention to the actual amount of money that you're spending on your health care. Maybe another reason is you've been frustrated with your doctor's office just because the service is just kind of subpar. I mean, I've personally seen those experiences too, and have experienced it myself. Like, I'll not have the best interaction with the receptionist or with the nurse, or sadly for some people it may even be with the doctor themselves. I mean, the worst thing that you can experience, especially if you're ill, is for you to feel more ill mentally or emotionally because of a poor experience at your doctor's office, whether it be lack of customer care or something of that nature. So that can be a frustrating point. And for some people, you're just spending way too much money on medications, or you can't even get the test done that you want because you've been told, or it actually may be the truth, that that lab or that medication is way too expensive. So those are a lot of the frustrating points that I've heard from a lot of people. Thank you so much for sharing your points. And those, again, are some of the reasons why I'm really excited about this innovative model of care. Doc McDiva says, I want to know the latest recommendations for supplements and disease prevention. That is so, so, so true. And I personally try my best to stay up to date about so much. Sometimes I almost blow my mind trying to like keep up to date about things, but it's so important because science changes every day. The tough part is that the human body is so super complicated, and it is nearly impossible to know. Well, it's impossible to know everything, but it's even much more impossible when you have limited time to be able to research anything related to your own care, let alone your patient's care. When you have like 10 minutes to see them and get them out the door, that is really tough to stay up to date on the latest recommendations, etc. Simone says, yes, she's experienced docs pushing meds, usually from her specialist and not her PCP. I'm sorry for that experience for you as well. So Dr. Nicole, and I think someone else had mentioned, the number of patients that the average family medicine doctor carries on their patient panel, meaning that patient can call up for an appointment, or they can call asking for certain labs, or that doctor has to call them or deal with some paperwork. Someone guessed 1,500, another guessed 1,000. The average number actually is between 2,500 and 3,000 patients. That's how many patients your average family medicine doctor is trying their very best to handle at any point in time. For me, I think I was able to query the last panel of patients I had, and I was carrying the last one that I had track of was about 2,800. So that's what the average family medicine doctor is carrying, a panel of 2,500 to 3,000 patients. So again, no wonder it can be tough to get an appointment if they are carrying that many patients, if they're having to juggle that many patients at a time. When we talk about expense, I just want to give you guys some perspective here. What do we currently spend on healthcare? I'd like to give you, it's going to feel kind of jaw-clenching, this breakdown. The average amount of money that is spent on healthcare for a typical American family of 4 that's covered by an average employer health insurance plan in 2018 is $28,100. $116. So the average family of four, American family of four, is spending on healthcare over $28,000 on their healthcare. And the average amount of money spent per person on pharmaceuticals or medications in 2017 is $1,000 per person. Okay, so that's like a massive amount of money that people are spending on their healthcare. The average cost of an ER visit was $1,233. The average rent is $817. We're spending more on emergency room visits than we are on our living cost. I mean, that's insane. And the average cost of an urgent care visit is between $150 to $200. I mean, I had to take my daughter to urgent care about a month or two ago, and I experienced sticker shock as well. We spent close to $200 on the visit alone, and then got a bill afterwards for labs that I didn't even realize I was going to be billed for, over $100 more for that. So it can be pretty insane. But guess what? With direct primary care, this innovative model of care, we are able to cut down those costs up to 90%. 90%. Cut way, way down on these inflated costs. So you're going to wonder, how in the good world is that possible? And I'm going to share it with you. So when you're not, basically, when you are not dealing with insurance, the dignity effect asks, is that including insurance premiums? Yes, it is. It doesn't, that 28,000, over 28,000 does include insurance premiums. So when you're dealing with insurance, unfortunately, the focus, as much as a traditional primary care doctor tries to focus solely on you, the patient, our focus cannot be. Because again, insurance companies need us to check this box, check that box, send this paperwork, send that paperwork, make this phone call, meet all these particular standards that unfortunately do not improve your care as a patient, but sadly detracts from our ability to provide you the best, comprehensive, most personalized care. When we are not dealing with insurance, we are able to focus on just you and not the middleman at all. And I'm not like a major conspiracy theorist. I'm not all about like stay away from the big guys and all this madness, but I'm just telling you the truth. I'm just telling you the real deal. I'm telling you what's really going on. And if any doctor wants to be honest about the situation right now, we've even got a couple of them on the live right now. That's a sad situation. That's what's going on. We don't want it to be that way, but that's the way that the traditional healthcare system has brought us to practice. We want to focus all of our time, whether it's 9 to 5, whether it's 7 to 8, whether it's 12 to 12 or 7 to 7, whatever time it is that we are in the office, we are in the hospital, we are in the urgent care ER, whatever it is, we want to focus 100% of our time on bringing our patients the very best care. But unfortunately, when we are operating with what insurance companies have forced us to operate within, it is impossible to focus all of our time and all of our efforts on providing care for you, to focus everything on you. So when we are able to deal with staying away from insurance, no co-pays, no co-insurance, no deductibles, no pre-authorizations, no extra silly details, no risk pooling, no data mining, your medical information remains just between you and your doctor unless you state otherwise, then we can give you the very, very best care. And I'm not telling you to drop your insurance. We're going to get into the details of that, so stick with me, okay? I'm not telling you to drop your insurance. Direct primary care offers an amazing model where you can cut down on your healthcare costs. Still keep insurance if you want to, if you need to, for catastrophic care, etc. We're going to get into it. But it's a way to get the most personalized, comprehensive, affordable care with your doctor. Kimberly says, Dr. Kim, thanks for joining us. She says facts. Amen. So she agrees. She's a doctor. She works in the ER. And she's saying, unfortunately, this insurance thing, this middleman, this extra stuff is interfering with our ability to give you the very best care. Dr. Nicole says, don't you still have to have insurance when you are a DPC patient? Great question. Let me get into it with you. So to dive deeper into this dilemma, all of you shared so many of the problems that you are currently having at your doctor's office with the traditional system that you're dealing with. Here comes direct primary care. Again, direct primary care is a way for us to deliver personalized, comprehensive care, enhanced access directly from you, the patient, and your doctor, whether it's your primary care doctor that has this practice, or some specialists are now starting up direct physician care practices. And through this model, you are able to get unlimited appointments by paying a low, affordable monthly fee directly from your patient, directly from the patient to your doctor. No middleman cutting in between. You can get unlimited appointments, guaranteed same or next day appointments when you need them, extended appointments for 30 minutes, 60 minutes, 90 minutes, whatever time you need to discuss your concerns in person. The ability to text, email, video chat, directly call your doctor's cell phone with this model of care. I am so excited and happy to announce that I am able to join this innovative model of delivering medicine, delivering the very best quality health care. We are starting a direct primary care practice called Synergize Direct Primary Care. So excited. In the Philadelphia area, we will be located in Delaware County, right outside of Philadelphia, in a town called Lansdowne. If any of you have heard of it, I'm so excited to offer this amazing care for you. And I will put the website in the comments for those of you who are interested. Unfortunately, I can't do that on Instagram, but I will put it in my profile after we are through. But basically, through Synergize Direct Primary Care, I can now offer personalized care tailored to your comfort level. The time to know your story inside and out, the choice to be seen at our office or via virtual care through FaceTime, Google Call, Zoom, Skype, whatever means that you would prefer, through text or email. The knowledge that you are one of only about 500 to 600 patients to each physician dedicated to your care. So we just said the average family medicine doctor carries 2,500 to 3,000 patients. In Synergize Direct Primary Care, we are only carrying a maximum, we are capping it at 600 patients. Once we're there, there's a wait list. That's the end. No more patients after 600, because we want to be able to provide that amount of people with the very best personalized, enhanced access care. And we know that if we continue into the thousands, that is not possible. So we want to provide you with the very best. Thanks so much for the congratulations, guys. I'm so excited. I'm so excited to be able to provide this, this amazing service, this amazing experience. We are going to give you quality time with your doctor, with plenty of time to ask questions. And questions are actually going to be encouraged. There is no need to rush you out the door. I will definitely be sure to, and any other physician that we end up bringing on board over time. Not only will you get quality time with me, but I have an amazingly talented and experienced health consultant to complement your personalized wellness solution if you opt to have one. And I'm going to bring him on board shortly just to talk about a little bit more about what our wellness services that are included in your membership. This low monthly membership will be a part of your care. Your doctor's cell phone number, that is in keeping with a commitment to enhanced access and services and steeply discounted medications and labs if you opt not to use your insurance. Let me repeat that again because I don't know if I made that clear. At Synergize Direct Primary Care, we are able to dispense medications in the office. So if you're prescribed any medications, most of the time, we can give it to you right then and there. You don't have to wait in a long line at the pharmacy. Not only that, guys, but we have been able to negotiate huge discounts on medications. I mean, we've seen discounts from 30% to as high as 85, 90% discounts on meds. I mean, like metformin, for example, for diabetes, the lowest price you might see, which is still an amazing price, we thought it was, right? $4 at Walmart, $4 at Rite Aid. We can dispense metformin to you for a little over $1 for 30 pills. Did you hear me? A little over $1 for 30 pills. There are antibiotics we could dispense for $1. I'm talking about amazing, amazing discounts that we have able to negotiate because we have cut out the middleman. I'm talking about wholesale meds, discounted prices on your labs. You can see it on the website. We've got some examples, but we've been able to negotiate amazing, amazing prices. I mean, like a complete blood count to check if you're anemic, for example, for $3. For $3, we can check if you're anemic. We've seen vitamin D levels, I think, around like $12, whereas insurance is going to charge you into the hundreds of dollars. It's insane. We can provide you inexpensive and direct service that cuts out insurance entirely if you want it, or you can complement it with your insurance. So to answer your question, Dr. Nicole, about do you need to carry insurance on top of the direct primary care model? So as you guys are well know with the current government regulations through the Affordable Care Act, it is required that you carry some type of insurance, and that's between you and the IRS, okay? If you decide to carry insurance, that is more than fine with us. Sometimes it is helpful to have that extra parachute. What we often recommend to complement direct primary care very, very well is when open enrollment comes through, which is going to hit us before you know it, October, November, to consider changing to a catastrophic care plan or what's called a wraparound care plan, where your premiums go much, 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 much lower. Or some people see it as the bronze plan if you're working with your employer, where you still have coverage for ER visits or hospitalizations if you require them, but through direct primary care, we greatly reduce the likelihood of that. Stats have shown reduction of hospitalizations and ER visits down to 80% less because you, again, have much more time to spend with your doctor to eliminate the need to show up for emergencies. But with catastrophic or wraparound insurance, your premiums go much lower. You're spending a lot less on your premiums. You have a high deductible, but you never really need to even access your insurance because 90% of what you need is covered through the direct primary care practice. So that's the best way. There's also what's called Health Share Ministries. If those of you, and maybe you're familiar with them, let me know. There's something called Liberty Health Share, or there's a bunch of them. I'm not going to advertise them specifically, but those cost significantly less than most insurance plans, but also cover catastrophic events, and they are in congruence, and they do comply with the Affordable Care Act qualifications or regimens. So hopefully that answered your question, Dr. Nicole. Let me just check in about the comments. So excited, again, for those of you who are joining me. Thanks so much for joining. Joe Lemon says, what about Houston, Texas? That's awesome. That's a great question. I will be happy to share a link with you guys. For those of you who are unfortunately not here with me in the Philadelphia area, there's an amazing resource called dpcfrontier.com. Where you can search for other direct primary care practices in your area if you are not, unfortunately, in our area. But I'm super excited to share this with you guys. Dr. Nicole said this is like Christmas. It really is in some cases for a lot of people. I mean, the gosh, the testimonies have been amazing so far. Aside from the amazing service and experience that you can get in a practice like this, this cost savings have been phenomenal for a number of people. So thanks again for all of your comments, and for those of you who are joining. Doc McDiva asked, do you offer telemedicine visits in your practice? Oh, yes, 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 girl. Yes, we do. Again, we are all about convenience and enhanced access. So sometimes, you know, you don't need to take a long drive to your doctor just for them to see a rash, or for them to tell you that you've got the flu. Sometimes you want to just stay in your house, or you don't want to take the time off of work. And we are trying to make this as seamless and easy and as enjoyable as seeing your doctor can be. So we are giving you the availability to text your doctor directly, to email, to Skype video call, Zoom call, Google video, FaceTime, whatever access you would prefer and sign up for. And we are able to do those telemedicine visits at your convenience, which I think is amazing for a lot of people and super helpful for a lot of people. So basically, we are excited to offer an experience like one you have probably never, ever experienced before. Top of the notch service, all the time you need, and amazing care from me and our team at Synergize Direct Primary Care. So talking about team, I want to just introduce you guys briefly to an amazing addition and compliment to our team at Synergize Direct Primary Care. I couldn't pull this off so far without him, and I know I'm not going to be able to continue to do so. So again, I talked about an amazing service that we're going to be offering through our membership, which is our wellness service. We have a health consultant with tons of experience in nutrition, in fitness, and also in holistic services. So it complements all the things that I hope to bring as well. And just a minor bonus, he happens to be my husband. So I'd like to introduce you guys to Dr Sumner. Mr. Dr Sumner, and he is also going to be a part of our team at Synergize Direct Primary Care. So if you can come and chat a little bit, Dr, about the services that you will offer. He hasn't been on social media for a little while, so I'm dragging him in finally. So if you can introduce yourself.
Hey, how you doing, everyone? Hi, I'm Mr. Dr Sumner Jr. Pleasure to be on tonight with everyone. I'm very, very, very excited for our new practice, the Synergize DPC, located in Delaware County in Lansdowne, Pennsylvania. So it is an honor to work with my lovely wife here, Dr. Felicia Sumner, and we have been working on this little jewel for quite some time, and we are happy and excited to present it to everyone. We can't tell you how excited we are about sharing everyone our dream and our hopes for the community with our DPC practice. So without further ado, let me talk a little about what I'll be bringing to the mix. I will be the health consultant / health coach for our team, and we will be doing some I would say a little bit of everything. I'm wearing a good amount of hats here. So pretty much as much support as I can provide here for my lovely wife here in the practice. So it will be health consulting, of course, health coaching. It will be some nutrition and education in there. There'll be some tobacco cesations. I'm also a certified tobacco cessation counselor in Pennsylvania. So if you're a tobacco user, and you're trying to quit and you tried, pretty much everything, I've got a lot of experience with that in different types of tobacco use, from dipping to smoking. So that's one hat I wear. And also, if you're interested in some type of even personal training, I'll be adding a little bit of that into the mix if you're interested in some nutrition education. So if you've tried pretty much all the different diets and fads, and you just want to try something different, I'm versed in a myriad of different wellness training. So I've got a lot of little tricks in my bags for people who've tried everything. So also, I'm a bit of a home chef. So if you're interested in how to cook, I will be offering some cooking classes. So as you know, men do know how to cook. So
This one does at least.
yeah. They say it's not always to a man's heart. Cooking is. It's also to a woman. So if there's gentlemen out there who are interested in learning how to cook for your family, especially your significant other, yeah, I got something for you. So I'll also be doing some some classes on if you're interested in like martial arts. There'll be something like that in there for you too. So I mean, I have a lot of different trainings. So there's going to be a lot of things we are going to be able to provide for our patients, and it's going to be we're basically bringing a whole different experience into this. It's not just I'm going to come to my doctor's office. No, you're going to come and you're going to expect an experience here. So we are really and truly excited about bringing that into the mix, and look forward also to doing a little cooking for everyone. So we're big on the holistic cooking, and so we might be doing that live for you in the future. So look forward to that, and you'll get a peek into our kitchen. We keep our kitchen pretty secretive in there. Not like we have anything crazy, but we like to keep our kitchen a private place. But we'll give you guys a little peek in there, and you can see all the fun things that we do in our kitchen to not just eat healthy, but also enjoy and have tasty seasoned food. Okay. So any other things to add, Dr. Sumner?
I think you covered. We've got a lot of tricks up our sleeve, but that's a big part of what Mr. Sumner here is going to be able to offer. In addition, Dr. Kim says she's going to be ready to move. She's 2 seconds away from moving to Pennsylvania now, so that's awesome.
Quite a compliment.
Yes,
really. Quite the compliment.
Yes to cooking live. Yeah, we're all about it. So again, with Synergize Direct Primary Care, we're going to be able to offer routine in-office free included services like EKG, nebulizer treatments, spirometry, so lung function testing, joint injections, ear irrigation, some skin lesion removals, abscess drainage, all these things that you usually go to urgent care for.
Exactly.
We want to be your medical home. You can get these things done on the spot the same day
at your convenience
at the direct primary care office. So our goal for this direct primary care office, and honestly for most direct primary care offices around the country, is to provide high quality, personalized care. Correct. To spend more time with our patients, to make this amazing care affordable. Because your financial health to us it definitely will affect your physical and your mental health. So why are we going to strain you financially only to make you more sick or more depressed?
Exactly. So who wants to be stressed out going into the office just to be rushed out? You want to spend time with your lovely physician. You want to ask them questions that are going to benefit your quality of life. Who wants to go into an office and feel like they're the enemy of their physician, right?
Mm-hmm. Yeah, not okay.
No, no, absolutely not.
A lot of you are probably thinking, okay, Dr. Sumner, so what is this going to cost me? I'm sure that's a big question for
$1 million. No, I'm kidding. I'm kidding.
$1 million.
No.
So believe this or not, guys, if you have already visited the site, you might have already seen it. Your monthly fee is going to be cheaper than the average cell phone bill.
Exactly.
Okay? What if you're even paying your insurance? Most people don't even meet their deductible. Your monthly fee is going to be less than the cost of coffee if you drank a cup of coffee at Starbucks every day.
Which we probably don't. Let's not.
We're going to encourage you not to do that when you become a patient of our practice.
Yeah.
So during open enrollment, once you realize how amazing this service is, like around October, November, we're going to be able to educate you about how to change to a catastrophic or a wraparound plan if that's what you want to do. We even have an insurance specialist that we're working alongside with, especially who can help you directly to find the best insurance plan to match these services. Exactly. So let's get into it. How much is this going to cost you? You can go to the website with me if you'd like, but basically, oops. Can you guys still hear me? I paused a little bit online. Okay. Basically, the cost is going to range between as low as $25 a month for your kids.
That's right. We love you. You know we gotta love the kids, right?
Yes, because we will see from ages 0 to up until the good Lord is ready to take you home, because that's what family medicine is. We can see everybody. So as low as $25 a month for your kids.
That's right.
To as high as $119 a month, depending on your age, but it is an age price tier. The average price is around $79 a month.
And you still get us. You get everyone. You get the whole package.
$79 a month, guys, less than the cost of your cell phone bill. And what's even greater than that, because I want you guys to get the most bang for your buck if you can, while you can. I don't think this is something to sit on for very long. Personally, I've learned to follow what's called the 5-second rule. Like, if you think this is great, take 5 seconds to think about it. And if it's not dismissed by then, act on it. Because most of the time, you end up missing an amazing opportunity if you take too long to think about it. We're going to give you even a better incentive to be able to join today. If you can join today, if you can join before our expected launch date of May 1st.
That's not far from now, so don't sleep on it.
There is a $100 enrollment fee for every patient who signs up. It's a lifetime enrollment fee. It plugs you into our membership for the remainder of the time you want to be a member or a patient of our practice. We are going to waive that $100 enrollment fee for anyone who signs up before the practice launches. Anticipated date is May 1st.
That's right.
Okay.
That's coming right around the corner.
So join as soon as you can. I'd hate for you guys to miss out on that amazing, amazing service, because personally, to me, nothing is more important than your health. I highly believe that it's worth it, and we are excited to provide you the very best experience you have had with healthcare in your life. So who is ready to join the movement? If you're in the Philadelphia area, don't waste time. And if you're not, it's okay, guys. Just message me. I'll help you find someone who's doing amazing things. Maybe not quite as amazing as we're about to do it, but pretty close.
Yeah,
okay?
It's hard to top the team here. It's pretty hard.
So who's ready to join? Okay, all you guys have to do is visit the website, www.synergizedpc.com. If someone can put that in the comments section for me, and click the Get Started link. Again, remember, until our expected launch date of May 1st, you can enroll and have your lifetime enrollment fee of $100 completely waived. So act now before it's too late. And remember, we are only going to accept 600 patients to this practice.
There's a cap. I'm sorry.
So we can provide phenomenal service to this particular group of people who were the early adopters. After that, it's going to be a waiting list. So after 600 people, I'm sorry, we'd love to provide this kind of care to as many people as we can. But to provide this kind of care, it has to be limited. It has to be capped. So we are only accepting 600 people to provide this phenomenal experience, phenomenal service to. And after that is a waiting list. So what questions do you guys have? I'm really excited again to share this amazing, exciting news with you all. We're super, super happy that you've joined us with the live. Let me see here if I can pull up any more comments. Dr. Lucy Pun said, congrats. She's a DPC doctor, and what she says, what we do is amazing, and that is so true. Dr. Kim says, amen to seasoning. Yes, seasoning is super duper important. No one wants unflavored food.
Exactly. Even though it's healthy, right?
Yeah.
I can't get it down. It's just
Bessie says she's in Louisiana. She needs to come meet us. Come on down. Come move to PA. We'd be excited to have you. And Kaplan says, I don't want to feel like the enemy. Absolutely not. Yes, that is so, so true. A few people are saying, yes, this is not bad. Dr. Nicole says, so affordable. Again, we are not trying to become like, Donald Trump rich off of this by any means. We want to be able to pay our bills. But we want to also be able to provide you the most affordable, amazing experience in healthcare that you can get. So super excited Doc McDiva says she wants to sign up, but she's not in PA.
Yeah,
I'm sorry. But like I said,
if you're in Delaware County, I'm telling you, we are
in the Philadelphia County at
area,
all, or even surrounding suburbs, because as I said, we are able to offer you guys telemedicine services, video chat, email, so you don't have to come and visit your doctor every 3 months, every 6 months, every other month. Even if you live further away from Delaware County, if you live in Philadelphia, if you live in Montgomery County, any other county within an hour radius, this is more than enough for us to be able to provide you. Nina says, awesome. Vivian says she'll check out the website. Doc McDiva says, Dr. Felicia Sumner is an amazing doc, so knowledgeable and compassionate. You would be blessed to have her. Thank you so much. Dr. Kim says she wants us. Oh, Dr. Greg says, love the name, so appropriate. And Dr. Greg is another amazing DPC doc, actually in the Philadelphia area as well. Thanks for joining us. Thank you very much, Dr. Greg. Thank you. And Miss Yomira says, hi, good to see us. Good to see you as well. Thanks so much for joining. So do you guys have any other questions? Hopefully we answered them for you. What if we want to come up twice a year for an exam?
Oh, sure.
If I am correct in this, if you want to visit us in the state of Pennsylvania and become a member, as long as I see you in person and you really want to see me from out of state, if I see you in person in the state of Pennsylvania, then you are good. So if you want to see me for an in-person visit, and then we can do telemedicine visits from then on, that is totally up to you, and I would be more than happy to accommodate. So feel free to join us in this movement as well. I'm super, super excited. Dr. Greg says, upstream care is proactive and costs less. Shift from sick care to accessible, affordable, patient-focused healthcare. So true. Dr. McDiva says, can she do that? So I answered that question. Again, if you are not in the Philadelphia or PA area and you're excited, super excited about what we're about to do, guys, and you want to still join, you can. And we will accommodate an in-person visit to get the ball rolling, and after that we can do telemedicine visits. But keep this in mind, we are capping at the 600, so don't take forever to make this decision. Nina says, I may have missed some details. What insurances do you accept? Okay, so just to answer that question again, we are a cash-based practice. That is so we can provide you the most accessible, most comprehensive and personalized care. We operate through a monthly membership fee, and we will allow you, of course, to use your insurance for ancillary services outside of our practice. So if you want to use your insurance for labs, for medications, to see specialists if you need to, then feel free to do so. But we are basically not going to accept any insurance, and that allows us to provide you the very, very, very best care. And Doc McDiva says, yes, then telemedicine after. Amen. Correct. So if there are any more questions, let me know now. I'm going to drop the link again on Facebook. It's www.synergizeDPC.com.
That's right.
If you would like to enroll today, then just click the Get Started link. That's on the website, and you can do an online enrollment, and we'll have you on the list once we launch. And if you have any other questions, then email us at contact@synergizedpc.com, and we'll be happy to answer those questions for you. And hopefully this has been helpful information. We're so excited to provide this amazing, amazing service, amazing healthcare experience for you. We want to be your medical home, and we're excited to have you join. Any other questions for now? Do you have any other comments?
Oh no, I'm just looking forward to cooking and showing everyone our skills also. So I can't wait.
Yeah, so stay tuned because, not stay tuned tonight, but stay tuned for our next Facebook Live, or one very, very soon. We'll show you some of Chef Doyne's skills here, and I'll be sous chef in the meantime. I can cook too, guys, but you know.
No, she can't.
She's
a great baker as well too. She bakes like nothing you've ever seen.
Well, so. Thank you. So if there are no more questions, again, this is Doyne Sumner Jr., my husband. I am Dr. Felicia Sumner Dr. Felicia Sumner Jr. I'm Dr. Felicia Sumner. I'm your board-certified family medicine physician. We are dedicated to helping you and your communities become well, whole, energized, and loving life. Join us at our practice, Synergize Direct Primary Care. We're super excited to have you. And again, just a reminder, until May 1st, our anticipated launch date, the $100 enrollment fee, lifetime enrollment fee is waived. So please get going with that sign up as soon as you can. We'd love to have you a part of this amazing practice. You guys have a great night. And until then, be well. Take care.
All right.